Bismillahirrahmanirrahim. Hadith of the day. Allah's Messenger, peace be upon him, said, whoever obeys me obeys Allah, and whoever disobeys me disobeys Allah, and whoever obeys the ruler I appoint obeys me, and whoever disobeys him disobeys me. Assalamu alaikum, everyone. I am Dr. Marina Akhtar, PGR Community Medicine. Today, my topic of presentation is Global Strategy on Human Resources for Health Workforce 2030. I am presenting this topic under the kind supervision of my professor, Dr. Saira Afzal. Learning outlines. Vision, goal, objective, and milestones of WHO documents on global strategy on human resources for health workforce 2030. Learning objectives. By the end of this presentation, the participants will be able to describe the development of a global strategy on human resources for health, its vision, goals, and objectives, importance and need of a global strategy on human resources for health, who are the health workers and their importance. 67th World Health Assembly that take place at 24 May 2014. Agenda item 15.8, follow-up of received political declaration on the human resources for health, renewed commitments toward universal health coverage. Who developed a global strategy on human resources for health? A paragraph 4 into 2 of that resolution, member states requested the Director General of WHO to develop and submit a new global strategy for human resources for health, HRH, for consideration by 69th World Health Assembly. The final version of the global strategy on the human resources for health was considered by WHO member states at the 69th World Health Assembly in May 2016. Why is having a global strategy on human resources for health necessary? We have better evidence than ever before on what works and what doesn't is health workforce development across different aspects, ranging from planning, education, management, retention, incentives, linkage with the social service workforce, a global strategy that addresses in an integrated way all these aspects can inspire and inform more incisive multi-sectoral action based on new evidence and best practices at the national level by planners and policymakers and at the global level by international community. Why do we need it now? The international community is working to identify a new set of the global development goals for the period of 2016 to 2030. The health workforce is one of the areas under consideration as part of the proposed health objective. The development of the global strategy on the human resources for the health now is therefore very timely because in its early stages, the process to develop the global strategy on HRH can also influence the decisions on post-2015 development agenda. And once these broader goals and targets have been set at a political level, the global strategy on HRH can provide concentrate recommendation and ideas on how to achieve them at a more technical level. This picture showing the effective coverage gap, human resources for health, availability, accessibility, acceptability, quality, and effective coverage. And this is showing the effective coverage gap, theoretical coverage by availability of the health workforce. Who are health workers? All people engaged in the action whose primary intent is to enhance health. These include physicians, nurses, midwives, laboratory technicians, public health professionals, community health workers, pharmacists, and all other support workers whose main function is delivering preventive, promotive, or curative health services. Why are health workers important? Health workers are the core of health system. Without health workers, there is no health care. National and global efforts to achieve the health targets of MDGs set by the United Nations in 2000 they thwarted in many countries by shortage of the health staff. There often inequitable distribution and gaps in their capacity, motivation, and performance. Similarly, the ambitious targets under consideration by United Nations as a part of the SDGs that will replace the MDGs will only be achieved by dramatic improvement are made to strengthen the health workforce. Isn't this a problem just for our poorest countries? Low and middle income countries face the most severe challenges in ensuring the sufficient fit for purpose and fit to practice workforce. A recent analysis conducted by the Global Health Workforce Alliance and WHO estimated a gap of 7.2 million professional health workers in 2012, set to rise to 12.9 million over the next decades. Countries at all levels of the socio-economic development face the challenges of how to sustain the human capital required to guarantee universal access and universal health coverage. With, with so many competing development priorities, are health workers worth the investment required? Investment in the health workforce is one of the best buys in the public health. For instance, investing in midwifery education with development to community-based service can yield a 16-fold return on the investment in terms of lives saved and cost of cesarean section avoided. In addition, evidence is starting to emerge on the broader socioeconomic impact of investment in the health workforce in terms of improving synergies with education, creating career opportunities for women, facilitating decent employment in the formal sector, and fueling economic growth. Vision. Accelerate progress toward the universal health coverage and UN Sustainable Development Goal (SDGs) by ensuring equitable access to health workers within strengthened health system. Overall goal: to improve health, social, economic development outcomes by ensuring universal availability, accessibility, acceptability, coverage, and quality of the health workforce through the adequate investment to strengthen health system and implementation of the effective policies at national, regional, and global levels. Principles: promote the right to the enjoyment of the highest attainable standard of the health. Number two, provide integrated people-centered health services, divide of stigma and discrimination. Number three, foster empowered and engaged communities. Number four, uphold the personal, employment, and professional rights of the all health workers, including safe and the decent working environments and freedom from all kinds of discrimination, uh, coercion, and violence. Eliminate gender-based violence, discrimination, and harassment. Promote international collaboration and solidarity in alignment with national priorities. Ensure ethical recruitment practices in the conformity with provision of the WHO Global Code of Practice on the international recruitment of the health personnel, mobilize and sustain political and financial commitment, and foster inclusiveness and collaboration across sector and uh, constituencies, promote innovative and the use of the evidence. Objective 1. Objective 1 is to optimize performance, quality, and impact of the health workforce through evidence-informed policies on human resources of the health, contributing to the healthy lives and well-being, effective universal health coverage, resilience, and strengthen the health system at all levels. Its milestones are 1.1 by 2020, all countries will have estimated as accreditation mechanism for health training institution. By 2030, all countries will have made progress toward halving inequalities in access to a health worker. By 2030, all countries will have made progress toward improving the course completion rates in medical, nursing, and allied health professional training institutions. Objective 2 is to align investment in human resources for health with the current and the future need of the population and health system, taking account of the labor market dynamics and education policies to address shortage and improve distribution of the health workers so as to enable maximum improvements in the health outcomes, social welfare, employment creation, economic growth. Its milestones are: by 2030, all countries will have made the progress toward halving their dependency on the foreign trained health professional, implementing the WHO Global Code of the Practice on the international recruitment of the health personnel. By 2030, all bilateral and multilateral agencies will have increased synergies in the official development assistance for education, employment, gender, and health in support of the national health, employment, and economic growth priorities. By 2030, partners in the Sustainable Development Goals will have made progress to reduce the barriers to access the health services by working to create, fill, and sustain at least 10 million additional full-time jobs in health and social care sectors to address the need of underserved population. By 2030, partners in the UN's Sustainable Development Goals will have made progress on Goal 3C to increase the health finances and recruitment, development, and training and retention of the health workforce. Objective 3, build the capacity of institutions at subnational, national, regional, global level for effective public policy, stewardship, leadership, governance of the actions on the human resources for health. Its milestones are: by 2020, all countries will have inclusive institutional mechanism in place to coordinate an intersectoral health workforce agenda. By 2020, all countries will have HRH unit with the responsibility to develop and monitor policies and plans. By 2020, all countries will have regulatory mechanism to promote patient safety and educate oversight for private sector. Objective 4, strengthen data on the human resources for health for monitoring and accountability of the national and regional strategies, the global strategy. Its milestones are: by 2020, all countries will have made progress to establish registries to track health workforce stock, education, distribution, flows, demand, capacity, remuneration. By 2020, all countries will have made progress on sharing HRH data through national health workforce accounts and submitting core indicator to WHO Secretariat annually. By 2020, all bilateral and multilateral agencies will have strengthened health workforce assessment and information exchange. Annex 1, health workforce requirement for the implementation of the global strategy on human resource for health. This table showing stimulating future supply of the health workers. Stock of health workers in millions 2013 and 2030. There is comparison where in different countries, physicians, nurses, and all others health workers and total health workers in 2013 and 2030. They are comparing, and there is the increase, there is the percentage difference in 2013 and 2030 in different countries: Africa, America, Eastern Mediterranean, Europe, Southeast Asia, and Western Pacific. In Southeast Asia, it is 75%. An updated need-based SDGs index of the minimum density of doctors, nurses, and midwives. In 2006, World Health Report achieved 80% coverage of the assisted deliveries by the threshold of 2.3 skilled health worker per thousand population. In considering a new health workforce threshold, the focus must shift to reflect the broader range of the services that are targeted by the UHC, Universal Health Coverage, and the SDGs. Coverage data for all countries available for 12 indicators were combined in an aggregate coverage indicator (SDG) index, which widened the importance of specific indicator based on the contribution of the diseases they track to the global burden of the disease. This picture, the table is showing indicators and the classifications. This figure showing SDG index composite method percentage of the 12 SDGs tracer indicator achieved as a function of aggregate density of the doctor, nurses, and midwives per thousand population on the basis of analysis conducted an inductive threshold of an aggregate density of 4.45 physicians, nurses, midwives per thousand population was identified as it correspond to the median core of the SDG. A tracer indicator attainment 25%. This value has been used for the need-based estimate in the analysis. And this table showing estimates of health workers need based on shortage in million in countries below the SDG index threshold in 2013 and 2013. And this table showing estimated health worker demand in 165 countries by region: Africa, America, Mediterranean, Europe, Southeast Asia, and Western Pacific. Annex 2, innovated list of the selected WHO tools and guidelines for the human resources for health. That includes transforming and scaling up health professionals, education and training, task shifting for HIV, and optimizing health workers' roles for the maternal and newborn health, increasing access to the health workers in the remote and rural areas through improved retention, monitoring, and evaluation of the human resources for health with special application of the low and middle income countries, analysis distributed health sectors. Annex 3, monitoring accountability framework. These include the monitoring and accountability framework of the global strategy entails a regular process to assess progress in its milestones. Global accountability will include a progressive agenda to implement a national health force accounts with annual reporting by countries on the core HRH indicator to the WHO Secretariat. This table showing monitoring and accountability framework to assess the progress on the global strategy milestones. Core WHO Secretariat activities in support of the implementation of the global strategy, develop a normative guidance, facilitate the sharing of the best practice, provide technical cooperation on the health workforce education, optimizing the scope of practice of different cadres, gender mainstreaming, availability, accessibility, acceptability, coverage, quality control, and strengthening of public regulation. It provide technical cooperation and capacity building to develop core competency in policy planning and management of the human resources for health, focus on the health system needs, foster effective coordination, alignment, and accountability of the global agenda on the human resources for health by facilitating a network of the international stakeholders. Review the utility and support of the development, strengthening and update of the tools, guidelines, and databases relating to data and evidence on the human resources for health for the routine and emergency setting. Facilitate the yearly reporting by countries to the WHO Secretariat on a minimum set of the core indicator of the human resources. To provide normative guidance and technical cooperation, facilitate the sharing of the best practices on the health workforce planning and projections, health system needs, education policies, health labor market analysis, and costing of the national strategies on the human resource for health. Now coming to the recent updates, our first article is the impact of human resources for health on the health outcome of Chinese people. Uh, the human resource for health cornerstone in the medical system. The paper combined the data envelopment analysis DEA with topic regression analysis to evaluate the efficiency of the healthcare service in China over the years between 2007 and 2012. The results showed that all kinds of the health personnel had a significantly positive impact on the efficiency, and more importantly, pharmacists played a critical role in affecting both the provisional and national efficiency. Therefore, the health sector should pay more attention to optimizing allocation of HRH and focusing on the professional training of the clinical pharmacists. Second article in the Lancet, published in the Lancet, is measuring the availability of the human resource for health and its relationship to universal health coverage for, for 204 countries and territories from 1990 to 2019, a systematic analysis for global burden of disease study 2019. The methodology of this study are through the International Labour Organization and Global Health Data Exchange databases. We identify 1404 country year of the data from labor force surveys and 69 country year of the census data with detailed micro data on the health related employment. Interpretations are considerable expansion of the World Health workforce needed to achieve high level of the UHC, universal health coverage, effective coverage, the largest shortage in the low income setting, highlighting the need for increased finances and coordination to train, employ, and retain human resources in the health sector. In the health sector, actual human resource for health shortage might be larger than the estimated because minimum threshold for each cadre of health workers are benchmarked on health system that most efficiently translate human resource into the universal health coverage attainment. Now coming to our MCQ session. MCQ number 1 is to achieve a certain target, a minimum number of the human workforce is required. According to 2006 World Health Report, how minimum skilled health workers per thousand population are required to achieve 80% coverage of assisted deliveries. Option A 1.3, option B 2.3, option C 3.4, option D 4.45, option E is 5.5. Answer is option B 2.3. MCQ number 2 is our country is facing challenges in retaining healthcare workers due to poor working conditions and low wages. To ensure sustainable retention of the health worker, the government plans to align with WHO Workforce 2030 strategy. Which initiative would best align with the Workforce 2030 strategy to improve health workforce? Option A, reduce salaries to balance the national health care budget. Option B is develop better workforce condition, including fair wages and career progression. Option C is enforce mandatory services in the rural areas without improving living condition. Option D is recruit foreign health workers on short-term contracts to fill gaps. Option E is prioritize technology over workforce investment. Answer is option B. Option B is right answer. MCQ number 3 is all people engaged in action whose primary intent is to enhance health, and all other support workers whose main function relate to delivering preventive, promotive, curative health services are the health workers. From the list given below, which are not the health workers? Option A is laboratory technician. Option B is public health professional. Option C, non-profit organization workers. Option D is community health workers. Option E is pharmacist. Answer is option C, non-profit organization workers. MCQ number 4 is the Ministry of the Health is planning to invest in human resources for health to meet To meet the need of the growing population, the aim is to align the investment with the future healthcare demands and WHO Workforce 2030 recommendation, which approach best aligned with the global strategy on HRH Workforce 2030 to ensure sustainable investment. Option A is invest primarily in advanced technology, reducing the need for human resources. Option B is focus on the short-term hiring of the health care worker to meet the immediate demand. Option C is align investment with the projected population growth, disease trends, and the healthcare needs. Option D, reduce training program for new health workers to cut costs. Option E is decrease health workforce training program to promote self-care practices. Answer is option C. MCQ number 5 is considering the cost benefit analysis. What do you think that investment in which health area is one of the best buys in the public health as it is the core of the health system? Option A, health workforce. Option B, health infrastructure. Option C, health related equipments. Option D, health related diagnostic labs. Option E is health related buildings. Answer is option A, health workforce. MCQ number 6 is, are developing countries focusing on increasing the production of the healthcare workers? However, challenges in the quality of training and skill mismatch have been noted. You are tasked with ensuring that healthcare workforce can meet the population's needs as per WHO Workforce 2030 recommendation. Which strategy should be implemented to address this challenge? Option A, increase the quantity of the health workers without improving training quality. Option B, lowering the entry requirements for the healthcare profession to increase number. Option C is invest in improving the quality and relevance of the health workforce education and training programs. Option D is focus solely on importing the health workers from other countries. Option E is create short-term online training program for quick workforce deployment. Answer is option C. MCQ number 7 is our nation is facing lack of reliable data on its healthcare workforce, making it difficult to plan for future workforce needs. The government is looking for the ways to improve the workforce planning in the line with WHO's global strategy on HRH Workforce 2030. Which initiative should the country prioritize to improve workforce planning according to Workforce 2030? Option A, rely on the and total evidence for workforce decision. Option B is establish a national health workforce information system for data collection and analysis. Option C is focus on the short-term hiring without workforce data. Option D is avoid data collection as it requires significant resources. Option is depend on international workforce data for decision making. Answer is option B. MCQ number 8 is health system can only function with the health workers improving the health service coverage and realizing the right to the enjoyment of the highest attainable standard of the health is not dependent on their availability, accessibility, acceptability, assessment, or service utilization. Answer is option D, assessment. MCQ number 9 is our Health Policy Research Institute is tasked with creating a long-term workforce plan of a country. With institute emphasizes the need of the solid evidence-based policies and accurate data on the current health workforce to inform the decision making. According to the global strategy on HRH Workforce 2030, which action is the most critical in this context? Option A is increasing production of the healthcare workers through short-term training program. Option B, improve data, evidence, and research for health force planning and policy development. Option C is focus on the attracting foreign health workers to fill the workforce gap. Option D is prioritize the investment in the new healthcare technologies and equipments. Option E is focus on the immediate recruitment without analyzing long-term trends. Answer is option B. MCQ number 10 is, you are the part of the government task force addressing the healthcare crisis in a rural region of our country. The shortage of the healthcare professional is severely affecting the healthcare delivery. You are tasked with proposing the long-term solution aligned with WHO Global Strategy on Human Resources for Health Workforce 2030. Which of the following would the most suitable long-term strategy according to Workforce 2030 for addressing the healthcare professional shortage in rural areas? Option A, increasing reliance on the international medical graduate. Option B, develop policy focus on retaining health workers on urban area. Option C, establish rural health training programs and incentive for local recruitment. Option D, decrease investment on the healthcare education due to financial constraints. And option E is increase health workforce workload without additional compensation. Answer is C. This is key of my MCQ. These are references of my presentation. This is a YouTube channel where all presentations are uploaded. Kindly like and subscribe. And thank you.
Thank you very much, Dr. Marina. This is a very nice presentation, especially about the WHO tools for human resource and the strategy of WHO and the guidelines that are being present for today as well as for till 2030. Would you please go to your MCQ number 8? I know that there is a lot of shortage of time, and that is why you have not given the audience this opportunity to make the correct choice. So, would you please go to your MCQ number 8?
Yes.
Now, would you like to tell me why you have said that D assessment is not in line because health is not dependent on their assessment? How can this happen? Because health system always need not only the coverage and right to the enjoyment of the high sustainable standards, but also the assessment.
Yes, ma'am. Actually, ma'am, sorry, ma'am, this is mistake in this MCQs.
Okay, please correct it, and thank you very much. And for future, I would like everyone to participate in MCQ session, and the presenter should wait for the correct answer.
Yes.
Okay, thank you very much. Allah Hafiz.
Thank you.
Allah Hafiz, ma'am.